Hello everyone, this is Kerry Anderson. Hope you all doing well. In today's video, I'll be talking about 8 things people with diabetes must know about the COVID-19 vaccines. So if you like the video related to my health, my way, I would like to request you all please to subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. It's a new year, and COVID 19 vaccines offer hope for those wanting to protect themselves, especially people with underlying health conditions such as diabetes. You may have questions about these new vaccines, including when you can get them and what questions you should ask your doctor about them. Experts we talked with say the vaccines are safe, effective, and important for people with diabetes. The most important thing is that people with diabetes get vaccinated as soon as it becomes available to them, says Robert Gaby, MD, PhD, Chief Science and Medical Officer for the American Diabetes Association in Virginia. Now, the first is when I will be able to get the vaccine if I have diabetes. It depends on where you live. At a federal level, the Centers for Disease Control makes recommendation about who should receive priority for vaccination. It is then up to each state to use those recommendations to plan for and distribute vaccines to countries and residents. Even so, guidelines are changing. In mid-January, U.S. Health and Human Services Secretary Alex Azar said Americans 65-year-old and those who are younger but have underlying health condition should receive priority, as AARP report. If your state is following the CDC recommendation, healthcare workers and nursing home residents are receiving first priority for the vaccine. Next, the CDC recommend vaccinating frontline workers such as firefighters, teachers, and grocery store workers, along with people over 75. Then the CDC recommend vaccinating people with type 2 diabetes and other underlying medical condition due to their increased risk of severe COVID-19 associated illness. People with type 1 diabetes do not currently have the same priority vaccination with the CDC, but groups including the Juvenile Diabetes Research Foundation and the ADA are advocating for this priority at a federal and state level. Justin Gregory, MD, Assistant Professor of Pediatrics of Vanderbilt Children's Hospital and Nashville, who has type 1 diabetes, says that people with type 1 diabetes should have the same priority for vaccination as people with type 2 diabetes because both groups have a similar increased risk of dangerous and deadly COVID-19 illness. In the end, states make their own decision about vaccination priorities, so check your state and local health department website to find out when you are eligible. The ADA has also assembled links to individual state vaccination plans as part of its COVID-19 vaccination guide. The second part is, does having another health condition with diabetes affect my place in line? Potentially, the CDC notes that the risk for hospitalization increases with the more high-risk medical condition as person has. It's 2.5 times for a person with one condition and 5 times for people with 3 or more conditions. Nevertheless, having comorbidities such as heart and kidney disease does not mean you will be allowed to get vaccinated before someone with only diabetes or another single health condition. Again, it comes down to where you live. In Massachusetts, for example, people with 2 or more underlying conditions are prioritized to get a COVID-19 vaccine before those with only one condition. Other states do not designate priority by the number of underlying medical conditions. Then the third question comes, when can I get a COVID-19 vaccine? One, people with diabetes are allowed. Where you can get a vaccine also varies depending on where you live. You may be able to sign up for a notification about availability of the vaccine with your county or healthcare provider. Pharmacies, hospitals, doctor's office, and health department will likely all play a role in administering the vaccine, according to a November report by the Kaiser Family Foundation. Your doctor can also guide you on where to seek a vaccine in your hometown. Then it comes to the fourth part. Are COVID-19 vaccine free for people with diabetes? The COVID-19 vaccine is free for everyone, regardless of diabetes status, according to the CDC. However, some providers administering the vaccine may charge a fee, which can be reimbursed by your public or private health insurance or by the Health Resources and Services Administrator Provider Relief Fund if you do not have insurance. Fifth part, why is it important to get the vaccine if you have diabetes? It's quite clear that people with diabetes do much worse than people without diabetes in terms of their outcomes with COVID, says Dr. Gaby. Early in the pandemic, a study from the CDC found that roughly half of people who died from COVID-19 under age 65 had diabetes. The protective effects of vaccine are critical for people with diabetes who are at increased risk for severe and deadly infection from COVID-19, says Dr. Gregory. His December 2020 study in diabetes care found that people with type 1 or type 2 diabetes are 3 times are likely to be hospitalized or experience severe COVID-19 illness compared with people without diabetes. Then the sixth part comes, are the vaccines safe and effective for people with diabetes? 2 COVID-19 vaccines are currently available in the United States, and the people with diabetes were included in both the vaccine trial. Both require 2 doses spaced to either 21 days or 28 days. With their 2 doses completed, these vaccines are over 90% effective and received emergency use authorization from the U.S. Food and Drug Administration in December 2020. We wanted to make sure we recruited a number of individuals who had the types of underlying medical condition that can make COVID more severe, says Buddy Creech, MD, MPH director of the Vanderbilt Vaccine Research Program in Nashville and part of the phase 3 trials of the Moderna COVID-19 vaccine. Then it comes to the seventh part. What side effect of the vaccine should people with diabetes pay attention to? In general, the most common side effect of both vaccines are pain, swelling, and redness at the injection site. Other common side effects are chills, tiredness, and headache. Most of these side effects were mild, but some people had more severe reaction that interfered with daily activities. Gaby say side effects of the COVID-19 vaccine are similar to those of flu vaccine for someone living with diabetes. Keeping a sick day kit with extra medication and supplies is beneficial in case you do not feel well. And last not least, 8th part, what questions should people with diabetes ask their healthcare teams about COVID-19 vaccine? Gaby says that first question patients should ask their provider about the COVID-19 vaccine is, when can I get it? Be proactive in calling your provider to ask for the vaccine, says Gaby. Check the website of your state and local health department to find out about local vaccine distribution. Being patient, persistent, and informed is the best approach, says Gaby. That's all about the diabetes in this video. I hope you all liked it. For all of you, I prepared a small presentation that will be going to share in the description box below. You can check it out from there. So before signing off, I would like to request you all, please do like, share, subscribe this video with your loved ones so that they will get to know better. So this is Gary Anderson signing off. Please do take care of your health. God bless you. Bye-bye and take care.